The team at St Mary's Hospital are here to support you through your labour. Managing pain is an important part of every woman's labour, and there are a variety of options available. It is important to remember that every labour is different, and the pain that you feel will be personal to you. This video aims to give you an overview of the options available. These include drug-free techniques, simple drug therapies such as Entonox, also known as gas and air, and more advanced techniques which require specialist management on the labour ward, including epidurals and the use of patient-controlled pump devices. Drug-free techniques. There are many techniques that can help you to cope with your pain during labour that do not involve the use of drugs. These include use of a birthing ball, the birthing pool, TENS machines, hypnobirth and aromatherapy. You will be able to discuss these options with the midwives at the hospital and your community midwife to work out which options may be best for you. Simple drug therapies. Entonox. What is Entonox? Entonox, sometimes known as gas and air, is a gas that you can breathe in during a labour contraction to help with the pain. How do you use Entonox? You need to start taking deep breaths of the Entonox as soon as a contraction starts. Remember, it takes at least 30 seconds to work. It is important to stop using it in between your contractions when you don't have pain. So what is good about Entonox? Well, over half of pregnant ladies will use it at some point in their labour. It has been used to help relieve pain in labour for over 100 years and is generally felt to be safe for most women and their babies. It is under your control, is quick acting and wears off in minutes. You are still able to walk about whilst using it, and it can still be used with most other pain relieving techniques including diamorphine injections and remifentanil patient-controlled systems. So what else do you need to know about Entonox? It can make you feel dizzy and lightheaded, and you may get a dry mouth. Occasionally you may feel sick. It will not take the pain away completely, but it will help you cope with your pains. And it can take a bit of practice to time the breathing of your Entonox with your contractions. Diamorphine. Diamorphine is a strong pain-relieving medication from the same family as morphine and pethidine. It is used very commonly in labour and is given as an injection at the top of your leg. So what is good about diamorphine? Well, it works within around 30 minutes and may last up to 4 hours. As well as helping with the pain, it can make you feel relaxed and help you cope with the pain better. So what else do you need to know about diamorphine? Well, it can make you feel sick. It can also make you feel a bit sleepy and slow down your breathing, and it can have similar effects on your baby, especially if you've had to have it several times during your labour. If necessary, however, your baby can be given an injection after birth to reverse these effects. Remifentanil patient-controlled analgesia pump, also known as a PCA. What is remifentanil? Remifentanil is a strong morphine-like pain-relieving medication that is very short-acting. The remifentanil medicine is attached to a drip in the back of your hand. A small amount of the medicine is given when you press a button. The remifentanil PCA pump is only offered on Ward 64, the consultant-led delivery unit, and is overseen by both your midwife and the anaesthetic team. How do you use a remifentanil pump? An anaesthetist will come to talk to you before you start this medicine. You will need a separate small drip in the back of your hand. While you are using the remifentanil PCA, you will be given oxygen and your midwife will monitor your oxygen levels using a peg on your finger. As soon as you start to feel a contraction, you should press the button. The medicine will take around a minute to reach its full effect. Timing when to press the button with your pain can take a little practice. For your safety, the machine will only allow a maximum of 1 dose every 2 minutes. To avoid side effects, it is crucial that it is only you that presses the button. So what is good about a remifentanil PCA pump? Using a button means that you are in control of your pain relief. It works quickly and wears off quickly, so you can time it with your contractions. It has a strong effect on relieving pain. But what else do you need to know about remifentanil? It can slow down your breathing. This is why you need to have extra oxygen and close monitoring of your oxygen levels. It can make you feel drowsy. It may make you feel sick, and you can get itchy when you're using it. You cannot start using remifentanil if you have had diamorphine within the last 4 hours. You will not be able to walk around once you have started using the remifentanil pump. Remember, however, remifentanil is very short-acting, so these side effects should not last long once the medicine is stopped. Epidural. So what is an epidural? An epidural is a small plastic tube which sits in your lower back. Through this, we put local anaesthetic medicine that numbs the nerves that supply your womb. When working well, they offer the most effective pain relief available in labour. What happens when an epidural is put in? An anaesthetist will come to talk to you before putting your epidural in and make sure there are no reasons for you not to have one. In order to place your epidural, you will need to sit up and stay very still. The anaesthetist will take every care to prevent infection while putting in your epidural. They will wear a sterile gown, gloves and a mask. They will make sure you are sitting in the correct position. They will clean your back with some cold antiseptic wash. You will then feel a sharp scratch and bee sting as they inject some local anaesthetic medicine into the skin to numb the area. Then you may feel pressure as they insert the epidural needle. Some ladies feel an electric shock in their leg as the plastic tube is threaded into place, which should quickly settle. If you feel this, then try to stay still, but do tell the anaesthetist. Once the small plastic tube is in place, the needle will be taken out so that only the plastic tube is left in. The tube will then be taped to your back and you will be able to lie back onto it. So how do you use an epidural? Once the tube is in place, the anaesthetist will give you the first dose of medicine down the epidural tube. This usually takes around 20 minutes to fully work. You can still use your gas and air whilst your pain is getting controlled. The tube in your back will be connected to an epidural pump, which will give you small amounts of medicine all the time. You will also have a button to press that will allow you to give yourself extra medicine down the epidural tube. For your safety, the pump is programmed to limit the amount of extra medicine that you can give yourself. If you need more than this, your midwife or an anaesthetist will help. So what is good about an epidural? In about 8 out of 10 women, the epidural works really well. In general, the epidural does not affect your baby. Having a button to press means that you have control over your pain relief. The epidural can sometimes be topped up with stronger medicine if you need to be taken to theatre for a caesarean section. What else do you need to know about an epidural? An epidural does not slow down how quickly your cervix dilates, but can slow the pushing phase of your delivery. There is a slightly increased risk of needing help delivering your baby by forceps or suction cup. You can get low blood pressure, itching or fever whilst the epidural is in place. The epidural will be removed immediately after delivery, but the skin where the epidural was put may be sore for a few days. Backache is not caused by epidurals, but is common after any pregnancy. About 1 in 100 women can develop a headache after an epidural. If this happens, there are treatments to help. There are some very rare but serious problems that can happen after an epidural, ranging from nerve damage to infection in the back. More details are shown in the table on screen, and are described in the epidural information card that can be downloaded from the St Mary's website. If you decide to go ahead with an epidural, your anaesthetist will discuss these with you in more detail. We hope that you have found this video useful. Remember that everyone's labour is different and the pain relief you need will be personal to you. Please feel free to discuss your pain relief options with your midwife or any member of the anaesthetic team.